So when we think about potential future therapies for neuronopathic or type 2 Gaucher disease, we're moving into an era obviously where gene therapies are the kind of goal, because a gene therapy would potentially replace that dysfunctional or missing gene, and so we could replace and create that protein for a baby that it currently doesn't have. So PRO1 is one of these therapeutic programs, which is an AAV gene therapy. And in type 2 Gaucher disease, this is being delivered directly to the intracisternal magna, so the base of the brain, into the CSF, so an intrathecal delivery of a gene therapy, which hopes to deliver that gene therapy as close to the place that needs it most, which is in the brain. And our challenge with all gene therapies is getting them into the tissues that we most want to affect. And so this is the current thinking of gene therapies that are delivered direct to the CSF, is that we can target the brain, which is the major organ that needs treating for type 2 infants. The PRO1 drug, so this AAV gene therapy, is being used by Prevail Therapeutics at the moment in a variety of different ways, targeting different aspects of Gaucher or GBA-related disease. So there's the PROVIDE trial, which is designed for type 2 Gaucher disease and is this intracisternal magna injection of AAV gene therapy for those babies that are affected by neuronopathic or acute neuronopathic disease. And then there's the PROCEED trial, which they're trialing in adults that have type 1 Gaucher disease, so this systemic disease that affects the bone marrow and the spleen and the liver. And so that is being delivered as an IV gene therapy rather than into the CSF, because clearly they're trying to affect systemic manifestations. And my understanding of that trial is that they are doing a dose escalation study. So they are treating as a group of patients at a certain dose, escalating up to a next dose, and assessing the outcomes for those patients, trying to identify the best dose of gene therapy, and then following those for a period of time to look at their longer term outcomes. Yeah, so currently my understanding as a pediatrician, so I'm not part of the adult GD1 trial for PROCEED, but I understand that they're currently recruiting, and so that is ongoing at the moment. I think there's a cohort of maybe 15 patients that they're trying to recruit initially in this dose escalation study. And so it'll be really interesting to see how that evolves, and it's really interesting also to see the response of the community to this approach to therapy. For a cohort of patients who have traditionally accepted enzyme replacement therapy, which is given every 2 weeks, to move into an era where they may be given a definitive therapy, which they receive once, and then in theory would be free of all additional therapies thereafter.